Thank you for staying on the AM show. It's now time for the news. And organizers of Occupy Jubilee House are proceeding with their planned protest this morning, undeterred by police efforts to secure a court injunction. The Accra-based civil society group Democracy Hub had previously informed the Ghana Police Service of their intention to hold a protest on Nkrumah Memorial Day, targeting the seat of government. Now, the protest aims to call the president and members of the economic management team to action in response to economic challenges in the country. While the police claim to have served organizers with a court application, the group disputes this and remains committed to the protest. Oliver Bakavomawo speaks for the group.
As far as I'm concerned, they are claiming that an application has been made. And by their own admission, there is no court order which is stopping the process from going ahead.
If you're served, would you call the protest off?
No, unless we are served, and let me be clear, unless we are served with a court injunction that requires us not to go ahead, because one of the things we do not want to is to follow those who have decided that they are not going to respect the authority of our democracy and join them in their misbehavior. So as long as we do not have an injunction of the court, we will proceed. If we are served with an injunction of the court, then absolutely call off the protest. The only thing that can go wrong is that the police will not respect their legal obligations. But I have ultimate faith in our democracy that the right thing would prevail.
Convener Bakavomawo also says the group has plans to ensure protesters don't indulge in acts that will contravene the law.
So they may go ahead and decide to do whatever. In fact, I cannot control what they decide to do. What I am telling you is that we are going to show up, we're going to be peaceful, we're going to have our hands raised all the time to show that we have no intention of attacking the police or whatsoever. And if they put any roadblock, we're just going to stand in front of the roadblock without breaching that. But what we want to show is that we want to stare down abuse of power and show that it is ultimately resistance and the morality of justice that wins.
In the last couple of hours, the Ghana Police Service has been responding to the claim that it has not served organizers of the demonstration with that injunction application. In a 4-point statement, the police says it served the group through its lawyers. And let me just bring you details of that. Police refute claim of non-service of court process by the conveners of Democracy Hub. The attention of the police service has been drawn to a press release by the conveners of Democracy Hub dated 20th September 2023, claiming that the group has not been served with a court process to prohibit them from holding their intended demonstration at the Jubilee House from Thursday 21st to Saturday 23rd September 2023. We wish to state categorically that the organizers of Democracy Hub were duly served with the application on Tuesday, 19 September 2023, through their lawyers, Atuguba and Associates. And for that matter, the organizers are duly aware of the pendency of the application before the High Court, slated for determination on Tuesday, 26th September 2023. The service of the process on the lawyers was elected and dictated by the organizers of the planned demonstration in their notification letter to the police dated 4th September 2023. A copy of that letter and the reference is attached to the statement. In the said letter, the organizers indicated that the police may contact them through their lawyers, Atuguba and Associates. As such, the court process was served on them through their lawyers. It ends by saying, we therefore urge the general public, in the interest of public order and public safety, to disregard any invitation by the organizers to take part in any unlawful demonstration. Signed by Juliana Obing, Superintendent of Police, Head Public Affairs Unit of the Police, Accra Region. Now, we will be keeping our eyes on this particular one and let you know how it develops in the day. Now, it appears Ghana may be wrongly computing the fishing season. That's the concern of some fishermen at La Abisse in the Ladade-Kotopong municipality. They say they are unable to make any meaningful catch at sea despite religiously observing the closed fishing season. Now, the closed season is observed as a way of reducing pressure on stocks when they are most productive, and this is to allow the fish a chance to lay their eggs to replace the lost population. But right after this season, fishermen are still unable to make a catch or good catch, and they're complaining about this with the price of fish already soaring. Ramat Bashiru reports.
Prices of fish is soaring as the commodity is in short supply. At Saide's Kenke joint, fish is costing an arm and a leg, and consumers are worried.
It's from 8 cedis. You won't get fish for 7 cedi, 6 cedi, not even talking of 5 cedis. So fish are very expensive now in Ghana.
I bought a little kenke with fish. I tell you the price of the fish, and secondly, they do count. They do count.
It's 6 cedis, that's the red fish. And the kpala is 15 cedis. And this one is 8 cedis, 6 cedis, 8 cedis, and 7 cedis.
It is Saturday morning at Labese Fishing Center in the Labadi community here in the Greater Accra region. Fishermen here are frustrated about the unusual state of their catch, which is already threatening their livelihoods. The chief fisherman, Henry Odoipeko, says despite the close fishing season, they are not making enough catch whenever they visit the sea.
The time of closing season is not going well with our fishing. If we don't argue with the government, but what we are saying is the time of July is our bumper harvest. Therefore, the time should be reversed to maybe June. The closing season may be reversed to June rather than July.
The pollution of the sea has also been cited as one of the causes of the gradually depleting fish stock in the sea, with some species going extinct. According to them, fish resources are threatened by human activities, including pollution, which has prevented them from fishing for the past 1 week.
Every plastic waste from interland drop to the shore anytime it rains. Therefore, you will see the pollution of the plastic, and it affects us most. Could you believe I will go for fishing, but return with plastic instead of fish?
This level of pollution is changing the marine ecosystem and affecting fish reproduction. Isaac Nunu is repairing a fishing net that he says was damaged after getting entangled with plastic waste. The sea is now filled with plastic waste. We don't even get fishes. You spend so much money on premix fuel and you go to the sea and make no significant catch. Our premix fuel is not even being supplied regularly. Isaac Tete, the canoe repairer of the fishermen, says the Chinese trawlers continue to commit acts of illegal, unreported and unregulated fishing in Ghana, hence the loss of income for artisanal fishermen.
The
Chinese are engaging in illegal fishing. They are using such high lights to catch all the fishes. We are pleading with government to deal with this situation. Fishermen are struggling. Odoi Atiku was hoping to go fishing, but is already having second thoughts as previous expeditions have simply not yielded any positive result.
The 2 weeks, about 1 day, a week, 1 day.
Water resources, including fishes, constitute an integral part of the ecosystem, supporting human lives across the world. And in Ghana in particular, fish is perhaps the most popular and cheap source of protein. But with these challenges threatening the efforts of farmers, state actors must begin to move in now and act. Ramat Bashiru's report for JoyNews, read to.
This is the news on the AM show. Now, management of the Chima Holy Family Hospital is appealing for infrastructure expansion. This is to enable it meet the healthcare needs of the region. With an annual OPD attendance of over 220,000, the facility, which serves as a referral center for the entire Bono East region, is doing more than its physical infrastructure can accommodate. Hospital Administrator Christopher Akanbobnab made this call during a visit by the Parliamentary Select Committee on Health. Anasabit has more.
The delegation, which was led by the ranking member and MP for Jaboso constituency, Kwabna Minta Akando, visited the Chima Holy Family Hospital to assess first-hand information as well as identify and address challenges hindering the smooth running of the facility.
Today we started visiting the facilities, and we are at the Chima Holy Family Hospital, and it's been a very interesting interactions. They've taken us through what they do. We've toured their facilities, and I think that I'm happy to be part of this history. We are all very, very excited about what we have seen. We only encourage them that we think that they can do more than they are doing. But so far, so good. They've done so well. I think they've had great impact on the health sector of this country.
Hospital administrator at the facility, Mr. Christopher Akambobna, revealed that the facility, due to its strategic location and serving as a referral center for the entire Borno East region, is doing more than its physical infrastructure could accommodate, and as such needs government support to help it continue with its healthcare provision.
Government has done this over the years, and we must acknowledge it. We are only saying we could even do more when you look at the opportunities that are available to government. We'd like to stress this and to ask for some support in terms of infrastructure for this institution. The hospital is doing a lot more than its physical infrastructure can accommodate. The reality, as you walk around, you can see everywhere is full. Even that you came at 2 p.m. when normally a lot of outpatients should be going home.
He, however, bemoaned the huge electricity tariffs the facility is currently battling with and appealed for a waiver of some tax components to avoid the total collapse of the facility.
This hospital and all that we consume, on average, every month we are billed 170,000 Ghana cedis. If you look at the rate of increase in terms of electricity tariff, it is far, far, far below the rate of review in terms of NHI tariff. Honorable members, this is our current challenge. And we would like to urge, and we know it's within your authority that you can do something about it, in whichever form, whether to look at the tax regime inbuilt in the electricity tariff, that is, a total waiver is impossible.
Member of Parliament for Chima North and member of the committee, Elizabeth Ofosu Ejari, admonished government to help in the expansion of the facility to help in its sustenance.
Because of the excellent care they give around this area, people from far and near come to get services from here. It is incumbent on government to help them to expand the infrastructure they have here. More importantly, they should also provide equipment, because if you have qualified personnel, what you need to do is to give them all the equipment they need to deliver quality service. So I think that government should come in handy to provide what they need, to provide excellent service for the people in this area and then far.
Alexander Akwasi Akwa is the MP for Akim Oda and also a member of the committee. He reiterated government's efforts in spreading healthcare to other parts of the country, hence the introduction of the Agenda 111 policy.
Yes, we agree that this hospital needs to be developed. We agree that this hospital needs more infrastructure and facilities. But the government program for Agenda 111 is to enable other constituencies and districts to also benefit, so we can spread healthcare services. It's very important. We know that.
The Chima Holy Family Hospital, with a staff strength of 1,086, currently has an annual OPD attendance of over 200,000 with ANC attendance of over 30,000. Reporting for JoyNews, Anas Sabit, Tichman.
Now, a youth group calling itself Concerned Youth of the Nadoli-Kalio district has hit the streets to register its displeasure on what it calls gross mismanagement of the district hospital by some core staff. They stated the hospital lacks basic logistics to take care of medical needs of the people and it's now under life support. They've also accused management for continuing the fueling of vehicles that are faulty and packed at the expense of the meager resources of the hospital. They've therefore given a 2-week ultimatum for this to be addressed. There's more.
The youth group, drawn from all parts of the Nodolo-Keleo district, first converged at the forecourt of the Nodolo Area Council before they kick-started the peaceful demonstration. They are unhappy with what they called gross mismanagement of the district hospital by some core staff.
Because anything you want, you cannot get it for now. When you go there for dispensary, they will tell you, they will write the medicine. As I'm a patient, and show you yesterday, I was even having a disease there. I will show it to you. And when there are 4 different types of drugs, they tell me to go to pharmacies and buy. Nothing was given to me. Even common treatment, the way they will ask you, they will refer you to any place that you can go and do your own thing. And they are there. What kind of life is that?
Man, this is the first time youth in the district have collectively come together to demonstrate against any government establishment since the creation of the district some 35 years ago. They spilled the major highway, otherwise known as N12 highway, that passes through the Nodolo township, singing and dancing to music from brass band. There was heavy police presence to ensure that nothing untoward happened during the course of the demonstration. All went well right from the start of the demonstration until they got closer to the main gate of the hospital and they demanded an entry into the facility, which the police fiercely resisted. Entry to the facility was not part of the route for the demonstrators. An argument ensued for over half an hour between the protesters and the police until the latter softened his stance and allowed them to come closer to the gate of the hospital. They later headed to the Makoy College of Education Park, passed through the forecourt of the Nodolo-Keleo District Assembly and ended at the Nodolo-Keleo District Directorate of Health Services. It was here that their petition was read by the secretary of the concerned youth group, Prince Sabogo.
The Nodolo District Hospital is in life support due to gross mismanagement, which led to the lack of basic logistics, including gloves, even common plasters and paracetamol, among other essentials in the hospital, inflating the cost of the main ward that was renovated. The recent visit of the health insurance CEO, Dr. Akakpo, to the hospital, the district health administrator and management said the hospital spent an amount of 87,000 to renovate the main ward, while in a different meeting with the staff, they said they spent 127,000 to renovate the center, and we want proper accountability. Management is still fueling parked vehicles that spoiled some years back, using our mega resources for their selfish interests. And how can a damaged vehicle still draw fuel from the public purse? We are demanding answers from the core management of the hospital. The Nodolo District Hospital that aid in promoting quality health to its people have provided accommodation to some core management of the hospital. But hardly do you see some of them sleeping there, but rather commute from work every day, resulting in low productivity. And also using the limited hospital resources at the expense of basic essentials.
They spoke of deep-seated rift among some critical staff of the hospital and also accused some management staff of the hospital of awarding contracts to themselves amounting to conflict of interest. They call on the Director General of the Ghana Health Service, Parliamentary Select Committee on Health, and other duty bearers to as a matter of agency to shake up the hospital to restore the hospital to its past glory.
We are by this demonstrating to register our displeasure, thereby calling on the High Office of the Director General of Ghana Health Service, Parliamentary Select Committee on Health, Upper West Regional Minister, Regional Director of Health Service, and the District Director of Health, and other key stakeholders in this matter to immediately shake up the 7 core management staff at the hospital to prevent the total barrier of our once Upper West Kolebu, which has now collapsed to a change compound. The petitioners are ever ready to use any other legal means to ensure that our legitimate demands are met after 2 weeks. If there is no positive response from authorities concerned, we will first move into the hospital and lock the administrator and continue from there.
Head of Finance at the Nodolo District Directorate of Health, Francisco Dong, received a petition on behalf of the District Director of Health Services for onward delivery to the Director General of the Ghana Health Services. Reporting for JoyNews, Rafik Salam, Nadoli.
We stay on health, and the Ghana Gas Company Limited has cut short for the construction of a 200-bed capacity hospital at the University of Energy and Natural Resources in Sunyani in the Bunu region. The project, when completed, will complement government's effort at providing effective health care and also achieve universal health coverage. Precious Semevo has more.
The first phase of the 200-bed capacity hospital at the University of Energy and Natural Resources in Sunyani will see the construction of an 80-bed facility within 24 months. Phase 1, which is already underway, will comprise an OPD, an administrative block, a lab, a pharmacy block, a mini theater, and wards, among others, with expanded emergency and specialty blocks in the next phase. At the sword cutting, the Vice Chancellor of UNE, Professor Elvis Asaribediakon, expressed his heartfelt gratitude to the Board of Ghana Gas and said the facility would reach out beyond the university in the provision of health care.
In the years to come, this hospital will serve as a hub for cutting-edge medical research, a training ground for future healthcare professionals, and a place where lives are saved and transformed. It will offer quality healthcare to our students, faculty, and staff, ensuring their physical and mental well-being. Moreover, it will reach out beyond our campus walls to provide vital medical services to our local community, bridging the gap in the healthcare accessibility and contributing to the overall betterment of society.
Bono Regional Health Director Dr. Kofi Amokodie also expressed the Directorate's delight in the proponents of the facility, which he said will complement efforts in attaining universal health coverage.
Whenever there is an attempt to bring up a health facility, then you consider the people coming with the idea as bringing life to the people around. We know that Ghana has, registered to attain the universal health coverage based on 2 prongs. And this edifice here is being provided to really create access for us and also to enable us Ghana ourselves towards the universal health coverage that we seek so much to attain.
Ghana Gas Project Manager Edongbole Inwea Anyama, on his part, said the project forms part of their social responsibility and expects stakeholders to care for it.
Ghana Gas is a national asset, and wherever our product reaches, CSR project must also get to that enclave. When you look at the community, the institution, health facility is something that is dear to their heart. And if Ghana Gas come to their aid of providing 200-bed hospital facility, it's not just a joke. I believe institution, as you know, will never let this facility go by. I believe the Ghana Health Service will also not sit aloof, let this facility deteriorate.
Precious for JoyNews, Sunyani.
Now, in response to growing global concern surrounding non-communicable diseases, the Chief Executive Officer of the Cape Coast Teaching Hospital, Dr. Eric Kofi Njedu, has urged the public to prioritize regular exercise as a means of prevention. He emphasized the increase in cases of heart attacks and similar ailments, and also spoke about the importance of preventive measures. He made these remarks during a Keep Fit exercise organized by the hospital as part of its 25th anniversary. There's more in this report.
Dr. Njedu's call comes as non-communicable diseases continue to pose a significant health threat worldwide.
Well, non-communicable diseases are becoming a very big global health concern. We want to give an example to the public that exercise is a way to health. When you exercise your body regularly, you have very active circulatory system, your brain is active, your immune system is superb, and you're able to fight many diseases. So once you use this medium to set an example for all the general public, all our clients, all the people of Ghana, that we should take exercise as part of our activities so that we can always stay healthy. It is not palatable to get sick and come to the hospital. It's our expectation that the people of Ghana will not get get sick, so that even as we come to the hospital, we can visit them in their homes to do health promotion instead of curative medicine that we are practicing.
He mentioned the significant strides the hospital has made in its 25 years of existence.
As you may be aware, in 1996, a foundation stone was laid here, just adjacent where you are standing, to pave way for the construction of one of the greatest hospitals that Ghana will ever have. That is the Central Regional Hospital, and now Cape Coast Teaching Hospital. In 1998, it was commissioned, and today it is 25 years old. We have indeed reviewed all the progress this hospital has made, and we are indeed very satisfied amidst the challenges that we have been able to keep this hospital together till this end.
Director of the Pharmacy Unit at the Cape Coast Teaching Hospital, Dr. Robert Inkum, also shared insight into the hospital's commitment to patient care. He highlighted the hospital's fully functional pharmacy unit, which conducts medication therapy reviews for every patient admitted to the medical ward.
Over the years, Cape Coast Teaching Hospital now has a fully fledged clinical pharmacy unit that seeks to ensure that every single patient that is admitted, for instance in the medical ward, goes through medication therapy review by the clinical pharmacist to ensure that all the drug-related issues are resolved here on the ward, so that this will improve the quality of care and optimize the drug therapy that the patients receive in this hospital. So as we are repositioning ourselves for excellence and in quality healthcare delivery, Cape Coast Teaching Hospital is expected to expand. We are poised to expand the pharmaceutical, clinical, pharmacy services in the hospital, such that every single person that passes through Cape Coast Teaching Hospital, we ensure that the drug safety, all the issues relating to medicine safety is very well catered for, and that you receive the quality medicines that you deserve to ensure that you will obtain universal health coverage for the people of the Central Region.
The event served as a platform for raising awareness about non-communicable diseases and promoting healthy lifestyles through regular exercise, reflecting Cape Coast Teaching Hospital's dedication to both treatment and prevention in the fight against these diseases.
And that's how we end the news here on the AM show. I'll be back with a review of what's on the news portals. You know, as it is, on holidays we don't have the papers, but there's still news making rounds, so do join me for that in a moment.